In this video, we will discuss the lacrimal drainage system with emphasis on its anatomy, physiology, and the causes of watering of the eye, which is a very common clinical complaint in ophthalmology practice. Components of lacrimal drainage system. The lacrimal drainage system consists of the puncta, canaliculi, common canaliculus, lacrimal sac, and nasolacrimal duct, which finally opens into the inferior meatus of the nose through the valve of Hasner. Puncta. The puncta are located at the posterior lid margin at the junction of medial 1/6 and lateral 5/6 of the eyelid. They normally face posteriorly. Canaliculi. Each punctum leads into a vertical canaliculus of about 2 mm forming the ampulla, followed by a horizontal part of about 8 mm. In most individuals, the superior and inferior canaliculi join to form a common canaliculus. Lacrimal sac. The lacrimal sac lies in the lacrimal fossa between the anterior and posterior lacrimal crests and measures about 10 to 12 mm in length. Nasolacrimal duct. The lacrimal sac continues as the nasolacrimal duct, which is around 12 to 18 mm long and opens into the inferior meatus of the nose. The opening is guarded by a mucosal fold called the valve of Hasner. Physiology of tear drainage. Tears secreted by the lacrimal glands flow along the upper and lower lid margins and collect in the lacus lacrimalis. From here, they enter the puncta and pass through the canaliculi into the lacrimal sac and nasolacrimal duct to finally drain into the nose. Lacrimal pump mechanism. It is divided into 3 stages. The pre-blink stage where the eyes are open, the blink stage where the eyes are closed, and the post-blink stage where again the eyes are open. In the pre-blink relaxed state where the eyes are open, the puncta lie in the tear lake. Tears flow along the upper and lower marginal tear strips and they pool in the lacus lacrimalis near the medial canthus. They enter the upper and lower canaliculi by capillarity and suction. With eyelid closure, the orbicularis oculi muscle contracts. Contraction of the pretarsal orbicularis compresses the ampullae, shortens and compresses the horizontal canaliculi, closes and moves the puncta medially, resisting reflux. Contraction of the preseptal orbicularis, which inserts into the lacrimal sac, pulls the lacrimal sac open, creates a negative pressure and draws the tears into the sac. With eyelid opening, the orbicularis oculi muscle relaxes. It causes the puncta to open, the lacrimal sac collapses and propels the tears down the duct. Simultaneously, with puncta opened, the canaliculi refill, completing the cycle. Watering of the eye or epiphora occurs due to either excessive tear production or defective tear drainage. Hypersecretion is commonly seen in dry eye where reflex tearing occurs paradoxically. It can also be due to ocular surface inflammation or irritation. In such cases, watering is associated with symptoms like burning, foreign body sensation, and redness. Defective drainage may result from punctum stenosis or malposition such as ectropion, canalicular obstruction, nasolacrimal duct obstruction, or failure of the lacrimal pump mechanism as seen in facial nerve palsy or lower lid laxity. To summarize, the lacrimal drainage system plays an important role in maintaining tear balance. The lacrimal drainage system drains tears into nose. Normal drainage depends on intact anatomy and an effective lacrimal pump. Epiphora results either from hypersecretion or from obstruction at any level of the drainage pathway.